Ingrown toenail surgery is very, very common. Ingrown toenails usually run in families. It's an inherited trait, but it can be due to trauma. In this particular case, it does run in this family, and it's been hurting for about a week or so. It is extremely painful to palpation. What we do is numb it with lidocaine or carbocaine, depending on the patient. We excise very small amount. The idea here is you can always go back and take out more, but once you've killed that root and you've taken out a section of nail, it's nice that it's not too big, so it looks totally normal. When they're not as infected, sometimes they're so infected we have no choice, but in this particular case we were able to remove just a small amount, possibly like a 1/16 of an inch, which will probably be plenty to give her plenty of relief. What I'm doing right now is doing a culture. After you take out the piece, you do the culture, you make sure you swab it, and then you curettage. The reason we curettage is there's always a little piece inside, which you could see right now, and we remove that in total. If you don't, odds are this will come back. To kill the root, we use a combination. I use a Surgitron with a radio wave. It has the Elman radio wave heads that are used just for nails. And I believe in overkill slightly, especially on a young person with very good circulation. If this was a diabetic, I would certainly cut down the amount of time as well as the intensity of the radio wave. After we finish the radio wave application, which we're doing right now, we do the phenol and alcohol. It's just an added precaution for regrowth. We see less than 3%, possibly more like 1 or 2%, but I do believe in overkill, especially on young people, because it is harder to destroy those cells than it is with the elderly. Also, they absolutely dread the needle aspect of it. She did particularly well, but nevertheless, I don't like to fail on ingrown toenails. Afterwards, we have them remove the bandage that day, start soaking it in cool water. This is a burn, and a burn will respond better to cool than hot. Hot will irritate it. We use vinegar, just a splash of it, and we have them soak this first week, very often using Amergel cream as well. After a week, we check it to see how it does, and that's when we start drying it up if everything looks good, and then all they do is pour peroxide on it and keep it covered. Typically, these drain anywhere between 4 to 6 weeks, typically closer to 4 weeks once the scab is formed. The biggest problem is as the scab forms, it gets caught in the bandage, and a lot of patients remove the bandage and the scab, and it starts to bleed, and they have to start all over again. So what we have them doing in cases like that is actually soaking off the bandage. We find it's just safer and easier, or using peroxide. There is no pain with this procedure. If there is any, it's because the bandage is tight and they didn't remove it in time, or we have them on the wrong antibiotic and there's still an infection. In any case, normally we do not do any pain medication with this. It's just a matter of soaking. We see the patient in 1 week, and we do put them on antibiotics. We take the culture because if we guessed wrong, then at least we'll know what we need to put them on.